Is your hygiene program unprofitable, a headache, unproductive? My name's Chris Menkhaus, and I'm the Senior Consultant at MGE, and today I'm going to cover 6 points to help you fix that. The first point, have an established perio protocol. This is a written out agreement as to how you treat patients in your practice. If you don't do this, very often you'll find what the hygienist does can slowly ebb down to the bare minimum, which is cleaning teeth. And sometimes the hygienist will even go from being the patient's provider to being the patient's friend. Now, there's nothing wrong with being the patient's friend as long as we maintain the viewpoint of being their healthcare provider first. Roughly 80% of the American population, by estimates, needs more than a cleaning. I would say on average, people coming in often only have 10 or 20% of their patients doing more than a cleaning. Make sure that all the tools are being used. Point number 2, have the hygienist make a list of all the procedures they can do according to the laws and guidelines of their state. This would include, in some states, mouth guards, scaling and root planing, gross debridement, limited perio scaling, mouth guards. There's many, many different things a hygienist can do. A lot of states, they can do sealants. I would list them out and look at how many of these a hygienist does and how often, and make sure that the hygienist is using all of his or her tools and feels comfortable doing so. And again, having an established written protocol about when you would use these things. This is the difference between a hygienist who's going to produce $800 a day to $1,000 a day and not get the patient healthy all the way, and an office where the hygienist does $1,300 to $1,500 a day on average, and that would be using your normal PPO insurances, and in some offices as high as $2,000 and $2,500 a day, and a large percentage of their patient base getting healthy. So if you think it's not profitable to hire a hygienist, think again. This is the difference between a really profitable hygiene program that gets and keeps your patients healthy in ever-increasing number and a hygienist that cleans teeth, or an office that doesn't even keep its patients in recall and getting healthy. Point number 3, schedule your adult patients for a sufficient amount of time. In most practices, this would be 50 to 60 minutes. This gives you plenty of time to do whatever procedure is necessary on the patient, gives the doctor plenty of time to do a thorough examination and to present treatment if needed. Or if there's outstanding treatment, it gives the doctor time to actually sit and discuss this with the patient. It's not in and out, it's not super fast, and it's not so long that it drags on for the patient. It also gives plenty of time for oral education, which again is a key factor. And that time that you spend building that relationship with the patient is a big part of why they come back and when they come back. Too often we see practices where they're trying to stuff in as many patients as possible on hygiene. Running it like a mill. You're trying to see 13, 14, 15 patients a day. It's not great service, and it's not comprehensive treatment. Far more important for most consumers, including patients, is the customer service aspect. You're also far more likely to have the time and the resources and the skills to get the patient healthy when you have a full hour with the patient, which after all, this is what it's all about, getting and keeping the patient healthy. Number 4, have a scheduling coordinator in charge of the hygiene schedule and production. This shouldn't be someone who has 4 other duties in the office. It'll pay for itself 100 times over. Someone needs to follow up on the patients. Ask yourself how many active patients you have versus how many total patients the practice has. If your active patients is less than 80% of your total patient base that you've seen since the office opened, probably you need a scheduler, possibly more than one in a very large office. This is the person who uses great customer service, great communication skills, and persistence to make sure patients show up on the schedule and to always be reaching out to patients who have fallen off the schedule and off their hygiene protocol to get them back and healthy. You'll find we have a complete outline of the scheduler's duties and training for what the scheduler should be doing on our online training platform and ddssuccess.com. Number 5, the hygienist should be friendly and interested in the patient. When I say friendly and caring and interested, I mean interested in their overall oral health, both perio and otherwise. Sure, they can ask about the kids or recent family events, but the focus should be on why the patient is there and giving them a great education and orientation to what they're doing and why they're doing it and how it's going to benefit them both short and long-term health-wise. Number 6, make sure you're adding hygiene days consistently. What we mean by that is generally at least every 6 months, you should be adding an additional day per week of hygiene. In a busy office, more than that. If you're not doing this, you're losing patients out the back door as fast as you're getting new patients, maybe even faster. For those offices with large patient bases to reactivate, this would go much, much quicker. It's not uncommon for us to see offices go from 2 to 6 hygiene days in as little as 6 months. To be really specific, when I say hygiene days, if you had one hygienist working 5 days a week, that would be 5 hygiene days. If I added 3 more days this year, I would now have 8 hygiene days, 1 full-time 5-day-a-week hygienist, and 1 part-time 3-day-a-week hygienist, and that would make a total of 8 days. Either case, you should be adding these on a regular basis. So that's my tip for this week, and I hope it helps. If you really want to build a profitable, growing hygiene department, you've got to come to our Profitable Hygiene Seminar, held throughout the United States and Canada. So that's my tip of the week. If you'd like more tips like this, click on the link below to subscribe.